Hey everyone, Jerome and Matt here with Karis Marketing Group. Excited to be with you today. We wanted to do a quick case study on one of our clients in the medical industry to show you some of the strategies that we've been using to acquire new patients and retain patients in his practice. Very, very exciting, cutting edge social media techniques. We started with a very simple website design for him. Which has been really effective for SEO. This is one of our themes here. You can see the social icons in the top. We are linking up to all his maps, and obviously Facebook is our big social media campaign to start with, just because everyone's on social media right now that is on Facebook. So it's a great market, and see the different drop-down menus, good branding, and then obviously our biggest part of our social media campaigns are always email capture. So we have a nice email capture box here. So the client does allergy and asthma care. So most of the people that we're targeting are have allergic reactions or asthma, lung problems, things like that. So we're going to show you some of our targeting strategies here, but you can also see the blog. We go do some posts about dust mites, springtime nasal allergies, things like that, and then obviously a call to action to make an appointment. So it's been a very effective website. I really want to go into the social media though, because that's our bread and butter here, Matt. And it's something that's been very, very effective in this industry. When we started with this client just a few months ago, we've been running this campaign for about 4 months. Their likes were at 63. They're now today when we're shooting this video at 667. So that's just in 4 months. They have great engagement. It's 48 people actually talking about this on their on their Facebooks, and there were 6 check-ins. That means 6 people actually came into the practice and checked in. We actually got a lot more patients than that, which we're going to go into in a little bit, but we actually 6 people checked in on their phone on Facebook, which means all of their friends saw that, and that really increases the value of your brand.
Right, and Jerome, one thing to point out with this page, we're talking about 667 likes here on Facebook. These are all people within an immediate mile radius of this location and of this practice. That's right. Very important. So these people are actual very valuable potential patients for this clinic, and therefore the whole purpose of this is to get them to not only trust the branding and the information of what we're getting for the clinic, but then to actually convert into paying patients.
Right, that's great. So we've been able to grow the social campaign. We're going to show you how we move them down the sales funnel, but I want to talk a little bit more about the engagement, because that's very, very important part. It's not only getting the likes, but getting them to interact with the page. And you can see some of these posts. We got a great recommendation here, 5-star recommendation from one of the clients saying, talking about asthma and her daughter, which is really just powerful because people see this stuff on your website. And then, just interaction, people liking posts, sharing posts with their friends, because when they actually click like, comment, or share, they all of their friends see it and become possible followers. And I want to show you one quick landing page we did too that we're running as a promotion. So this is the landing page we created here, and here we actually are capturing a name and email address in exchange for a $50 gift certificate. It's been a very, very effective campaign. So I want to talk about that, because the big part is, getting these likes is nice, but people ask me all the time, how do you convert them into actual patients? And you do that with email marketing.
Right, and Jerome, just talk about this page a little bit here. The importance of this page is not only as what you see with the quick call to action, very clean design, but the more importance of it is it's all mobile friendly and it's built on a responsive design. And this allows us to do direct targeted to mobile phone users with this type of application, and have those mobile users, do a quick call to action. We receive their information. That information gets sent to the clinic. The clinic follows up, is able to talk about the clinic, what services they offer, and then convert them into patients. So it's very, very effective.
Right, and that's a good point, Matt. A big part is we don't just leave the client with the email list and say, okay, here you go. We actually have a whole automatic follow-up system, right, where we keep sending them valuable information about allergy tips, about asthma, about things like that, sending them back to the website, sending them back to the via email marketing back to the blog. Do you have dust mites? Things like that, just to keep them engaged in the content, because that's really the goal here, is engagement. And we talk about this in our presentation, but it takes an average of 7 to 9 points of contact before somebody will trust your brand. So just because they contacted you on Facebook once, that's not good enough. We want to hit them at least 7 times before they'll actually become a new patient.
Exactly.
So what were the results here? We really grew the email marketing list. The first month starting this campaign, we got 3 new patients into the practice with our ROI tracking. Second month, we got 5 new patients. Third month, we got 3 patients again. And then this last 4th month, we've had a huge increase up to 8 patients.
8 patients, right.
Just for the month. So you can see the ROI is huge on this type of campaign. I mean, the market on social media is so open, and if you know what you're doing and are using some of the techniques that we're talking about, the competition really doesn't know how to do these things. It's
right,
amazing.
and Jerome, just to expand on the ROI a little bit and the rate of patients of what we received over the last 4 months, when people look at these numbers and when the practice look at these numbers, we explain to them, look, it's not just this one time that the patients show up. What all you need to understand and to realize is it's the lifetime value of a patient. If your practice can actually service these individuals very well and actually have them become returning clients, then we'll come and actually they'll return back to your practice and be able to have them over the next year, a couple of visits, maybe 2-3 visits a year, times that out by a couple of years, and then you'll really see the ROI on that.
Right. It's exactly that lifetime value. And I think what's so powerful, just to wrap up, is that we now have a big following that maybe haven't come into the practice yet, but they're paying attention, and one day they will come into the practice. It might be a year from now, who knows? But they're going to be following us. I mean, I've seen people on a list that have come in and actually purchased 3 years. I mean, I've seen markets who do it 5 years later. So it's all about building that long-term database, building those long-term relationships. So I hope you enjoyed this video here in this case study with allergy asthma. If you have any questions, please feel free to contact Matt and I on the contact page here, and look forward to giving you more great case studies and more tips.
Great.